For those I've not had the chance to meet, and there's not too many of you, I want to make sure you know this is not my normal voice, and it's also not my morning voice. I've been up for many hours, like many of you. I've had a little bit of that fall cold, but I'm very, very excited, and hopefully it'll pass over the next couple days. But I want to give you a warm, warm welcome, and I'm just so, so excited to be here, not just because it's a year into my role here as President and CEO of BMA, but it's now been 3 years since we've been able to have an in-person gathering. So it's just so exciting to be here and being with the BMA team, and I want to thank them all for pulling this together with all the work that we've been doing with our allies, and a shout out to Robin Garacki, who I can't even see because there she is. Robin, thank you so much for all you've done with the team to make this possible. For those of you who may be unfamiliar with BMA, we're an alliance that represents over 180 allies and over 600,000 beneficiaries who are grassroots seniors, who are all working together nationwide to improve health care through a strong, innovative Medicare Advantage. We commission research, we meet with lawmakers on the Hill, we work with the administration, and we're empowering those seniors to advocate for themselves and to use all those diverse voices and disparate interests around the same table to strengthen and champion the needs of more than 29 million seniors who count on the coverage and care that Medicare Advantage brings. And we're now in our 6th year, and at this annual MA Summit, we're very excited at this event to bring together meaningful conversations on the future of care delivery and the emerging policy and trends in Medicare Advantage, and most importantly, to hear from all of you on what our areas of focus should be. To that end, we're looking forward to discussions over the next 2 days. And as many of you know, Medicare Advantage is going to be eclipsing half of Medicare enrollment as soon as next year. Meanwhile, average premiums have dropped again to the lowest level in 16 years, just $18 a month. And meanwhile, separate research shows that Medicare Advantage beneficiaries save nearly $2,000 a year in total health expenditures. That equates to meaningful financial relief and peace of mind during a time of higher household costs for so many of our seniors, and I know that are your parents and family members and friends. Also, while this is happening, consumer satisfaction in Medicare Advantage stands at a near universal 94%. Over 99%, and again, that's over 99% of Medicare Advantage plans provide supplemental benefits, dental, hearing, and vision coverage, and that it continues to even meal delivery and rides to appointments. And that's closing the gaps in care and addressing social determinants of health. And I know many of you work in that space with the MA community and with those seniors. Thank you for all that you're providing, and I know in our panels we're going to be talking a lot about those benefits and services that you provide. And as Medicare Advantage is continuing to do all of this at a lower cost to the taxpayer in delivering billions of dollars in additional value and savings to the government, continuing though to serve a proportionately more diverse and lower income and more medically complex beneficiary population than fee-for-service. At the Better Medicare Alliance, working to ensure that those facts about Medicare Advantage reach seniors and policymakers alike, and we've seen great success in that effort, and we thank you all for being part of that effort in our advocacy. And just this year, as you heard from those several members of Congress, and you'll continue to hear from members of Congress in these videos over the next 2 days, there is a bipartisan record. A combined 409 members of the U.S. House and Senate have sent letters to CMS declaring their support for Medicare Advantage. And I want to thank you all for being a part of that effort, and I want to recognize Chris Long, who's in the third row, and I'm going to have Chris raise his hand and embarrass him, for working with all of you, our Vice President of Government Affairs, who's been working with your teams, working with the Hill and the members of Congress to be a part of that outreach effort. Seniors have a strong partner in this administration at HHS, and we're so grateful for our partners at HHS and those we'll be hearing from over the next 2 days. Secretary Becerra has said that it's important to safeguard Medicare Advantage so that it remains a strong, successful program, while CMS Administrator Brooks LaSure has hailed Medicare Advantage as a critical part of CMS's vision to advance health equity and expand access to affordable coverage and care, and she has said that recently. As we celebrate the successes in Medicare Advantage, we're also asking where we can do more. Some of you joined us at our in-person gathering just this September. That felt so long ago. It was only last month. It's done so much since then. Thank you to so many of you who were a part of that convening. On supplemental benefits, we convened in July, and both at Health Equity and Supplemental Benefits, we were taking stock of the progress we've made, but also what more we need to do, and the barriers, and we're going to be producing reports from those two convenings of barriers that exist and what more we need to do, and we're going to share that information with our partners in the administration as well as on Capitol Hill. Others of you have joined with us as we endorse bipartisan legislation to build on Medicare Advantage's community work on modernizing prior authorization, and you heard from a couple of the members of Congress on the work that we're doing with them there. And it's really important that when we're working with those members that we realize when we have made progress, but we always want to recognize where we can do more. And so thank you for being a part of that recognition and where we can partner with Capitol Hill. We are continually committed to doing more to be a part of the efforts of innovation, affordability, and quality care that the hallmarks of the Medicare Advantage program in the past and in today, and as we look ahead. We have so many outstanding speakers today and tomorrow, and that's what excites me in being a part of the panels and the breakout session. So less from me and more from them. And so I just want to highlight what we're going to be hearing from today. After I speak here today, I'm going to jump to a keynote interview with Dr. Catherine Coleman. Many of you have worked with Catherine over at CMS. I'm going to do an interview with Catherine. She's the director of the Medicare Drug and Health Plan Contract Administration Group at CMS, and I'll give a full introduction to her when I sit down with her. We're also going to have a presentation on the Medicare Advantage landscape from our research partner, Allison Reiser at ATI Advisory, who's an expert in this space and really relied upon in the healthcare community. And then we're going to have the breakout sessions where you're going to have an opportunity to choose topics that best suit your interest. And then we'll close the day with a cocktail reception. And so I think what we're going to turn to next, I know we started the day with the members of Congress, so now I want to turn to introduce a special video and pre-tape message from CMS Administrator Chiquita Brooks-Asor. She could not be with us this morning. She is traveling today and tomorrow. Fortunately, we do have the Liz Fowler with us tomorrow, who is traveling today also. She is coming from Arizona late tonight, and we're fortunate she's going to be with us tomorrow. But we're so fortunate that the CMS Administrator is sharing these pre-recorded remarks. I know many of you have worked with Chiquita. She, in her role at CMS, brings decades of experience from the federal government, from Capitol Hill, the private sector, and she played a key role in the implementation and the passage of the ACA. She previously was Deputy Director for Policy at the Center for Consumer Information Insurance Oversight within CMS. She also served as Director of Coverage Policy at HHS, and she worked on the House Ways and Means Committee. So again, she brings the congressional experience and the HHS experience. And she has led the charge of being a partner with us, with stakeholders, as well as everyone else at CMS, and we're so grateful. And she brings the leadership in partnering with the alignment on health equity and expanding access to care. And you cannot have a conversation with her without the leadership she shows in that space. So please, let's turn to the video and hear our virtual message from CMS Administrator Chiquita Brooks-LaShore.